Welcome to This Week in Health IT Influence, where we discuss the influence of technology on health with the people who are making it happen. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health leaders. Today we have a great show around cybersecurity with leaders from the Cleveland Clinic, which we're going to get to in just a second. I want you to know that I'm out there looking for sponsors right now, and I'm pursuing sponsors that I believe in so that I can speak about them with confidence and I can recommend them to you strongly. And today I'm excited to announce a new sponsor in Health Catalyst. In the digital age, cloud computing is an essential part of more effective healthcare and precision medicine, but healthcare organizations themselves are still facing challenges in migrating to the cloud. Currently, only 8% of EHR data needed for precision medicine and population health is being effectively captured and used. 8%, that's amazing. Learn how Health Catalyst's data platform brings healthcare organizations the benefits of more flexible computing infrastructure in the cloud. Visit thisweekhealth.com/healthcatalyst to download a free ebook on how to accelerate your use of data in the delivery of healthcare and precision medicine. Welcome, Health Catalyst, to the family of sponsors who are dedicated to developing the next generation of health leaders. Here's our schedule for the next couple of weeks. The Friday shows will not stop. They are recorded. They will continue through the holidays and into the new year. And we have a lot of great interviews lined up for you. Plus, we have 2 end-of-the-year episodes, Year in Review, and the Top 10 podcast. The Year in Review is just me looking at the various episodes and pulling out some of my favorite clips from that and sharing that with you. The Top 10 episode is just what it sounds like. There are top 10 episodes for this year in terms of number of listens. I'm going to pull out a clip from each one, and we're going to do a countdown so you'll know which is the most listened to podcast of the year. And I'm looking forward to doing that. Now to our show. So today I'm excited to be joined by Ed Marx, CIO of Cleveland Clinic, and Vugar. I'm not going to say your last name. We're just going to assume like your Cher or Madonna, Chief Information Security Officer for the Cleveland Clinic as well. Good morning, gentlemen. Welcome to the show.
Hey, good morning. Thanks for having us.
Good morning, Bill.
So Ed, one of the things I appreciate about having you on the show is we end up talking a lot about life. And for our audience, we're gonna jump into the architecture, innovation, and other things. But before we do that, I'd love to hear how the recovery from the cancer diagnosis is going for you.
Oh, it's awesome. I am fully recovered. So I consider myself very fortunate that I only had cancer for 45 days between time of discovery and time of lab results proving that the cancer was gone. So I'm very thankful. In terms of the physical recovery, I am back racing again. So in the last few weeks, I've raced multiple 10Ks, which is a good barometer for my overall speed as a duathlete. And I podium finished in all of them, and the last 2 took first place. So very happy with the recovery so far. So
that's fantastic. And you still have like a minute to drop off your time if I'm following your social media correctly.
Yeah, that's right. So normally I'm about a 6.5 minute miler to be competitive. And I've gotten down to 7.5. Over a 10K, I can go a lot faster, obviously on a shorter run, but for 10K, that's where I am today. And I need to get to 6.5 by end of the year. So I'm on track to do it.
Man, that's fantastic. So has your time as a patient influenced your thinking as a CIO at all?
Yeah, certainly. It reinforced many aspects, where we are all big believers in digital transformation, digital technology. It's really these technologies that not only helped save my life, but enabled me to return to the quality of life very quickly. I can't imagine not having it. That's why I believe we have a moral and ethical responsibility to ensure that all that we do as IT professionals, security, as vendors, everything, we have this responsibility to ensure that this same capability is available to everyone across the world. And it is. I mean, we have the tools today. So it's really important that we all are passionate about this and get this job going first in our organizations and then in our communities and beyond.
Yeah, that's fantastic. Vugar, you're going to be probably new to our audience. So can you give us a little bit of your background and what you're doing at the clinic?
Sure, Bill. So I've been in cyber for 27 years now, probably as long as the industry existed. Worked with the US government and NATO in Europe, financial institutions, Canada and the US, help them to stand up their security programs. For the past 12 years, I was in healthcare with payers, medical device manufacturing, and now providers are the next frontier. And if you think of my career, it evolved almost like cyber evolved, from government to finance to payers, pharma, and now providers.
Wow. Well, that's exciting. So today we're going to dive into cybersecurity and other things, but I think how I'm going to do it is we're going to really look at four topics: strategy, architecture, operations, and innovation. And I think you guys have done a ton of work over the last 2 years in each one of those areas. And so let me just start by, if you were going to put those in order, you're coming into a new organization. So strategy, architecture, operations, innovation, what order would you address them as you come into an organization? Either one of you guys.
This is perfect for Vugar because he came into the organization with this fantastic background, and there was really no security organization when he stepped in. So he is best to speak to this because he actually came in and had to go through that thought process that you just talked about and that ordering. So Vugar, why don't you share, a little bit about that journey?
Bill, all these fantastic organizations I had the privilege to serve, I have to say that this is probably the most challenging role I had. And here's why. All these great institutions, they had all the important things in the world. They had their finances, they had their brand, reputation, intellectual property, and Cleveland Clinic has all that too, when you look at the cyber landscape. But on top of that, we also have patient safety with hundreds of thousands of medical devices.
Yep.
Patient privacy, people come here at the most vulnerable time of their lives. And on top of everything else, if something happens to their data, it's a devastating experience. And then things like virus outbreak in all the other industries means you can't process transactions, you can't process claims, which is really, really bad. For us, it means babies in NICUs, people in coma, and loved ones storming the hospitals trying to find out what's going on if the network is down or the phone system is down. So the impact is amplified by the nature of what the institution does. On the other side, admittedly, provider industry is behind government and payers and finance. And that creates, it's almost like economy of crime. If you have high value assets, and right now healthcare information is probably the most valuable in the black market.
Yep.
And then your defenses are not up on par, that's the economy of crime. That's why you see this proliferation of healthcare breaches. So speaking of where to start, when I came in, prepared my 100-day plan, was planning to do what I was trained over the years, do strategy development, current state, future state. But what I learned really quickly is that first, because we're behind, and if we do everything the way we've done before, we will never catch up by definition.
Yep.
Second, it's almost like a lot of my common practices that I learned over the years were challenged in lieu of some common sense. For instance, there was no reason to learn something we already knew. Like we had some cyber hygiene issues that we had to focus on. So the very first thing we did is focused on stopping the bleeding, addressing some easy to tackle issues. And then the way we communicated to the organization, just to get the message across, we focused on diagnosis, right, to understand where our risks and weaknesses are, and put together a treatment plan, which defined our path forward.
That was my experience coming in as a CIO. I was named an interim CIO, and then the following week we had a breach. And so, I mean, it's it gives you the sort of the thing where you're sitting there going, okay, we're going to put together a good strategy, and then we're going to put together governance, and then we're going to put together education, training, and all these other things. But at the end of the day, as Mike Tyson says, you could have your plan until you get punched in the nose. And we got punched in the nose 7 days after I took over as interim. And you realize that, we are going to do the strategy, but we've got to make sure our systems and our processes and our processes and our architecture, we have to make sure all those things are sound today. So there is almost a, start bailing the water out of the boat, also patch the boat and do all those things at the same time. So what have you found to be the most effective process for setting strategy, the cybersecurity strategy for a system of this magnitude?
Well, the very first thing we did, and we had similar experience to what you're describing, is I took my entire team through what we call journey of the patient. We visited every single facility, and we went from admission to discharge with my team.
Wow.
At the same time, I went and met with all the key leaders within the organization with a very humble message. This is a very humbling place. We get to work with the best of their field. So my message was, help me understand, because if we understand, this is a green field, we can focus on the areas that are most important to you. Second, if we understand and heaven forbid something happens, then we can make better decisions for the organization. It's like if they know their patient, they can rush them to the operating room versus doing all the diagnosis. Yeah. And finally, I asked for forgiveness. I told them, if there is one thing we guarantee, is that things are not going to be smooth. And when things happen, we want to have a relationship in place so they can pick up the phone and call. Because this is new to the organization, and then looking at size and complexity of this organization and what we do is rolling out cyber program here was quite a challenge. So we started with understanding, and through that experience, actually, I got the best wisdom you can think of. They were very open, very forthcoming with some thoughts of what's the best way to communicate cyber to physicians, because you think about it, they have lives of people in their hands. And here I am talking about bits and bytes. So how do you bring the world of bits and bytes to the world of saving lives? And some of these experiences you're describing that helped us quite a bit, because those two worlds are coming together. Yeah. So the way we constructed the strategy, we follow the standard strategic development process: current state assessment, future state, target state, gap analysis, all that. But the key was the way to convey to the organization using the language that our physicians are familiar with and they can understand and appreciate and connect with.
Yeah. So Ed, all this work is going on. I assume you have so many tasks that you're trusting Vugar to really run this thing. But how do you support him in this? How do you come alongside of him as the CIO?
Well, we are in lockstep together on everything. In fact, we report up together to the board of directors, so our audit committee specifically, on all things cybersecurity, and it's so that they understand that this is our top priority, is to ensure the safety of all of our information and data for the reasons that Vugar mentioned. So that's one way, is to be very visible with them. Whenever we have to do anything that causes a lot of organizational change, and you imagine with going from a no cyber program to a very robust cyber program, there's significant change and change management required. So Vugar and I always typically present together. So again, it's showing that in-person support. I have Vugar provide routine updates to our executive team, because rather than have me talk about it, I want them to hear directly from Vugar and know who he is. And like you said, when he first arrived, he did an excellent job of developing relationships and communicating. So we want to have that relationship continue. So it's constantly promoting what he's doing, giving him visibility, showing my direct support. And then maybe the final thing is really ensuring appropriate funding. So like everywhere else, we deal with budget, stuff and prioritization. And it's really critical that cyber receive the funding that it requires. And so it's really making sure that we get everything that he needs for the cyber program to be successful. So those are probably the three big areas that I show support.
Yeah, that makes sense. So Vugar, how important is system and data architecture in maintaining a strong security posture?
Bill, if there are two things that significantly impact the cost of cyber defenses, would be lack of standardization, because if we have standard systems, we can put all the security protections and roll it out. Yep. And the second is lack of data governance. I mean, people compare data to crown jewels. Imagine the Queen of England walking around and throwing her jewels on every bed and expecting the Secret Service to protect it.
Yeah.
So if you would know where the data is, just like she stores all her crown jewels in this locked room with laser beams, we can do the same thing. We know how to protect data. The challenge is, especially in the academic research center, data is everywhere and it's on the move. So those are the two biggest challenges we have. And strategy and architecture, you think about it, it's a quality discipline, just like a cyber. So having structured architecture process that defines where we want to be as an organization, having structured engineering process that helps us to build systems and build capabilities that are have all the controls and all the protections and everything else in place. And then discipline operation, they're all contributing to one goal: quality of the systems. And cyber is helping to enhance that quality, because if it's not there, that cost of poor quality tips into operation and causes outages, causes breaches, causes all these quality issues that we observe.
So how does security get integrated into governance? So one of the problems I found, and you touched on it, was lack of standards. So we had 800 some odd applications at our health system, and new ones coming in, like that IT didn't even know about, that were just sort of popping in. And so one of the first things we had to do was get in front of governance, and but then we had to insert a whole new set of security framework within governance in order to make sure that these things were not going to expose the organization or the data in any way. And so beyond the normal checklist, which has now sort of become a almost comical, hey, let's make sure this application is secure, and then you get this 14-page document and you check all the boxes, and then somebody goes, yeah, it's secure. Hey, we're good to go. How are we integrating security into the governance process?
You want to speak about the governance process before I mention about how we plug in security into it?
Yeah, so as I mentioned, like from the very top, this is endorsed by our CEO, our cyber program, and how important it is and critical it is. And that really sets the tone, I think, for all of governance, and then getting down to the specifics that operationally that Vugar will speak about. And then it reports down through the board, and we provide these routine updates. And then it just becomes, when it comes to the IT level, we sort of split the responsibility between IT, so myself, as well as our chief compliance officer, who has compliance and audit, and he doesn't report to the CEO, he reports directly to the board. So because of these multiple channels, one direct to the board, one indirect through a subcommittee of the board, it ensures that we have visibility and support from the very top of our organization. So it's very top of mind in terms of the overall sort of structure and governance. But in terms of the specifics, you can talk about the specifics. Sure. And some. Well,
actually, Vugar, before we get that, so Ed, where does architecture, the architecture of the environment, really reside within IT? Is that in the hands of a CTO, or is that some other place within, somebody who's looking at the whole thing, saying, okay, we've made sure that this not only security but also interoperability, integration, all those things. Is there somebody looking at that, or is that sort of distributed?
It's somewhat distributed, but in terms of the architecture, if I'm to ask, this is funny because this is a current conversation that we have. If I were to ask I want to see the drawings, the actual drawings of our architecture, how we architect the network, how we architect unified communications, how we architect all the interoperability. So we're organized by domains. We're an agile company as IT. And so that is in our, what we now call digital health domain. And within that is the infrastructure piece. And so it's carried out in that function. So it's a lot of, because that's where, as I mentioned, infrastructure and our CTO is. So a lot of that resides at that level. And then from a clinical applications, that all reports up to the same domain. So a lot of that is in that domain. Now there's some architecture that is in some of the other domains, so it's a little bit distributed, but I would say 80% of it is within our digital health domain.
Great. So Vugar, the integrating security into the governance process, how have you done that?
Sure. So from reporting perspective, just like Ed outlined, I have dual reporting relationship. I report to Ed as a CIO, and through him to the CEO. And I also report to the Chief Integrity Officer, who's in charge of compliance and internal audit, and he reports directly to the board. So that's the reporting structure. Yeah. As we started, we established the governance council. We have two-tiered governance council: executive cybersecurity governance council, made of Ed's peers, and then the management governance council, which is the step downs, which is the operational arm of it.
So if I'm a physician and I come up with a new app that I'm like, hey, just went to HIMSS, have this great thing, it's going to help us in the area of oncology, I want to bring it in. I go to, how does it filter up to those groups?
Sure. So we'll also, since Ed's arrival, we started putting together a structured IT intake process. So the idea is, we don't want to create a separate cybersecurity intake process and then separate IT intake process. We wanted to consolidate it all under a single entry point to the organization. So if someone wants to add any new application, new system, or anything else into our environment, have to go through a structured IT intake process. And cybersecurity is plugged into it from the inception. So during the ideation phase, and what we've done, we transformed our organization from where it was a set of disjointed cyber functions. And in every project, you would have 7 people from cyber, some from identity, others from network security, and so on and so forth. We consolidated that and exposed that through a series of services. We have an advisory function, just like major consulting companies do, if you will. So there's a cyber organization that builds all that awesomeness, and there is an advisory team that diffuses it to the rest of the organization, and single point of accountability. And it has a set of cybersecurity architects that act as a conduit, making it easier. So rather than you're getting 600 questions right from the beginning, from the inception, you would have a cybersecurity architect assigned to whatever domain that application is coming from. That individual will represent all the cyber functions, help you to plug in security right from the inception into the solution. Because everything we do, every time we put security during the requirement phase, it's going to cost us $1. If we wait until the implementation, it's going to cost us $100. And if we don't do it at all, it's going to spill into production as a cost of poor quality. Yep. So that simplifies it for our customers, right? The engagement process. And then moving into that service delivery model, it simplifies things for us as well, because it streamlines our processes, makes it consistent to the organization so they know what to expect. And then overall, the customer service is increased.
Great. So I'm going to jump to operations. This is where the sort of the rubber meets the road here. And then I want to close on innovation. It would be remiss of me not to talk to you guys about innovation, given where you work and what you guys are doing. But let's talk about operations. So security breaches, we know most of them are caused by people, either our users or even our administrators not following processes and those kind of things. How can a health system minimize that exposure, the exposure of the people? Or I guess that's the question. How can a health system minimize that exposure?
Right. So this is so let me peel that off into several kind of sub areas. First of all, having consistent security protections across the environment. And it starts on the operational side, it starts with having consistent data. So if we would have good asset inventory and we would know what our cybersecurity protections are deployed across our environment and make sure they consistently applied, obviously that, and that applies to everything, right? So from things like antivirus and all the way to patch management and other backup and other essential controls that you have to have in place. That's one of them. And that, to do that, we actually build a fairly robust data that metrics console, where we have feeding from all our security tools and IT tools, feeding it into a centralized like data lake, if you will, and delivering a set of consistent metrics to identify these variations from the standards and chase them. The second aspect that you outlined is privileged user management. And you're right, that's one of the biggest challenges. is locking down privileged access. And you can imagine the size and complexity of this environment. We'll have like tens of thousands of systems and applications and so on and so forth. So we started a privilege management program, first with introducing an ability for us to control that. So we can vault people's passwords and they can go through a consistent way of accessing their systems, and we can record what they're doing while they're accessing. And then the second one is streamlining and trimming it down to the acceptable level. It's a multi-year investment, given our size and complexity, that we're embarking right now.
Yeah. So Ed, I want to sort of ask you, when you come into a new health system, regardless, most CIOs I know who have come into even well-functioning health systems identify operational gaps right out of the chute. How do you drive a culture of operational excellence within IT? And I assume you put together some program or went after. That was probably one of the first things you went after, I would assume.
Yeah, you definitely need to do that assessment pretty quick. You're obviously brought in, if you're brought in externally, there's probably a pretty good reason why. And I think a lot of times it has to do with the fact that there are gaps. So it's quickly, ascertaining what the gaps are and then building your team to help address the gaps, because you're not going to do it by yourself, not successfully. Yes. So, you identify those gaps, build a team that can help you fill the gaps, and then, develop the plans, ensure alignment, and start taking action and execute. Obviously, these are not serial. They can be done. Some of these can be done simultaneously. So it's just really hiring great people. I was so fortunate to have Vugar as part of the team. He actually came here a couple of months before my arrival and had already did exactly that. See the gap, develop a team, develop a plan, and start to execute on the gap. The other couple of things we've done, Bill, that I may have mentioned in the past is we went completely agile. So as we got the right people in the right spots, we developed this agile culture and philosophy and way of work. So we completely changed the way we work. That was one thing. So that helped us become much more customer-centric, much increased speed of delivery, and those sorts of things. The second thing we did is we adopted ITSM, which is like best practices for how you do IT across all industries. And we made it a matter of employment. So everyone who existed had 1 year to get the training, which we provided, and then the testing to pass. Any new hires have 6 months to get the training and pass the test. And so that's happened a few months ago, where everyone, that 1 year expired. And now we operate in best practice for IT. Let me show you one quick example. Hold on. I rarely have paper. It's probably not going to work on the camera. But what this shows is our serious safety events. So you see, this is January, September, the first time ever recorded history, we had no serious safety events. Vugar mentioned earlier that we use the vernacular of our business, which is clinical. So we call them serious safety events. In ITSM or in most IT shops, you would call it major incidents. So we had 0 major incidents in September, first time ever. And then you couldn't see it very well probably from the graph, but we had 4 or 5 months of just 1. 1's too many, but 1 is much better than what we used to be. So our objective key result back in January, that's how we measure ourselves, is through OKRs. As an entire organization, that's how we ensure organizational alignment. A CEO has OKRs, and they roll all the way down to the individual level. Anyways, ours said 50% reduction in serious safety events, and people said impossible. In fact, I was a little bit doubtful. We're on track. So I rarely have paper, but I had to tape this in my office because I was so proud of the team for achieving that. So that's a long-winded answer to your question, but that's how you go about achieving operational excellence, is by focusing, hiring the right people, the gaps, the plan, and executing and focusing on the right things, and then measuring it and being transparent about it, and then holding people accountable. So again, I know this isn't about your question now, and I'm going to kind of go off tangent, but what we do, just like our organization, when there's a serious safety event, I'm involved in all of them as a member of the executive team, and people are held accountable. They come to our team meetings and they explain what happened, what they're doing, what the root cause was, what we're doing to make sure it never happens again. We do the exact same thing in IT. So whoever is responsible for that serious safety event, it's not meant to be punitive. It's meant to be learning. They come, they explain what happened, what they're going to do, make sure it never happens again. And then we hold people accountable. They should never show up twice for the same reason.
Well, and the other thing is you celebrate it. I mean, you have that chart for a reason, and it's probably posted in your office so that anybody who comes in realizes, hey, this is a metric that really matters to the executive team, from the CEO all the way down, and it should matter within the organization. So you celebrate it, you highlight it, you keep it in the forefront, and all that builds that culture. So it's all those things you said, and it's continuing to elevate it. And that's not always easy, because I'm sure, Ed, you're getting pulled in 1,000 different directions.
Oh yeah, it's very difficult. We're a large, complex organization, but it really is a testimony to our great team. And I don't mean just IT, although we have started to put together a pretty amazing team. But everyone in our organization works as a team of teams philosophy. So it's working closely with nursing, with medical staff, with finance, with supply chain. Everyone working together helps achieve goals like this.
All right, last 5 to 8 minutes here. So I want to hit on innovation. So this is a topic everybody wants to talk about, but it's important to talk about security and operations and architecture, because innovation rides on top of that. So digital innovation, digital transformation, where are you seeing the most movement in this area, either within IT or within healthcare as a whole? And I'd love to hear from both of you on this.
Yeah, I'll let Vugar talk first, because I would love, Vugar, if you spoke about the GSOC, CSOC, which you'll explain what that is, because that's highly innovative, I believe, first in the world.
So I think innovation, especially in the world of cyber, which typically perceived being naysayers, innovation starts with being innovative within cyber itself. So we've been pushing the boundary. Like, as I said, if we would do things the way they've been done before, we will never catch up. So we're looking into ways to leapfrog in the future. And the only advantage of being behind is that you can learn from strengths and weaknesses of others. Yeah. So having done this multiple times, there were a couple of things we're doing very, very differently. First, moving our entire organization to Agile, just having the entire cybersecurity organization, including our operational capabilities, running in Agile, and moving away from large-scale projects to products. Here's why it's relevant. If you think of our adversaries, most of them, well, excluding nation states, they may not have better tools or even better funding than we do. They're just more agile, more nimble. They're very focused on what they do, whereby cyber takes its cues from a structured IT processes around planning and discipline, right? Something emerges, new technique emerges on the cyber world. It takes us years to go through the approval and adoption cycle before we can put some protections in place. Being agile and nimble and having these product teams that have a very, very clear mission. It's almost the same as moving from a traditional armed forces battling insurgents to a set of special forces that have a very clear mission. They have all the funding pushed down to the product level, and they can make decisions fast and in a nimble way. It allowed us, for example, in an environment like this, deploy some protections to 70,000 assets within 3 months, from inception to fully completed, because there's no large coordination effort that's required. Other things that we do very differently. We're moving into cloud before anyone else does. So we're moving our entire perimeter into the cloud. We also established our cybersecurity operations center, co-located it with what we call global security operations center, where physical intelligence from our protective services organization and digital intelligence coming together and operating together. I think this is pretty new to the industry.
Yeah, I think that might be first in the world. We're sort of checking that out. So that's really important, because we do have a GSOC, Global Operations Center, because of we're a global company. So we have assets around the globe, and so but marrying the two together, because those lines have become blurred. So it's very innovative. And of course we do all the innovative things you would suspect. I was in a surgery yesterday. So I work, I think I mentioned to you before, on Wednesdays. I spend about 10% of my time working in the OR now. And so I'm an anesthesia tech. And I was assigned to the surgery yesterday. And it was a very complex case. And part of the issue was just the breathing airway for this particular patient. And so we took all the imaging that you would normally have with, 3D imaging from radiology, from our imaging institute, and then we created a 3D model. So with that 3D model, we actually knew the exact structure of the canals and the bronchi, to where the tubes would go and to fix this airway. And because it was a very unique structure, which was very potentially problematic. So with that, we could actually perfectly measure things and know what kind of scope, what size of scope to use, what length of scope, all these different things that otherwise we would have been, people normally in the past would have perhaps experimented, while you're working with your patient. But we knew ahead of time because of this innovation. So that's just one example. And it's so much fun because I actually get to be part of it and be part of that patient care process. We have so many. That was just the first that jumped to my mind.
And actually, I'm gonna ask you after this last question. I'm gonna ask you to how can people follow you and that kind of stuff, because you hit on agile within the environment. You hit on the innovation within security, and I know you guys are doing just a ton of clinical innovations that people have access to, and that you guys are very open in sharing. So, but the last question I want to get to before we come back to how people can follow you or learn more about this stuff is, if you were to leave the clinic today, and I've been asking a bunch of people this, and you were going to do a startup. So I'm gonna give you a couple $1 million to do your startup. What area would you choose to innovate in, and what might that look like?
So for me, it would be, again, so at the Cleveland Clinic, we want to double the number of lives touched. And the only way, while we grow through M&A, the only way to really do that effectively is through virtual. So I would begin something virtual that would help everyone on the planet. So for instance, today, what we're talking about is when we open up our hospital in London in 2021, we would love to do the first transcontinental remote heart surgery. So a complex heart case where our experts would be here in Cleveland and the patient would be in London. And so we're making steps, planning that direction. Now, take that a little bit further. And what if you were in remote, I have a medical clinic I think about in Tanzania. And so what if those patients there, we could also do high acuity care for those patients somewhere remote where they have only the very, very basics you can't even imagine. But what if we could provide world-class healthcare to individuals in that village? That's what I would invest in. I think we're getting very close to being able to do some pretty amazing things. Even our app, our patient app, our first ever, comes out, our first ever in terms of the type of functionality that you would expect from a world-class organization, actually came out today, but internally, soft launch, we'll have a hard launch probably in a couple of weeks. But even that in the future, we'll have capability to do virtual reality, so you actually interact with your clinician, looking at your own body based on images and kind of walking through it and looking, you have a left meniscus tear in your knee. So here's what it looks like. And you kind of walk around. I mean, that's so cool. And then you can visualize, be more engaged. And then, to the extent we can do more therapies and all that kind of stuff. So that's what I would do. What about you, Vugar?
If we're talking about cyber, one of the biggest challenges the cyber industry has is communicating value to our business and our clinical leaders. It's been always a challenge, right? How do you present actionable intelligence back, first for decision making, second for validation, because typically clinical leaders view security as an insurance almost, right? So let's make sure nothing bad happens. In reality, there is so much more, right? Like that little yellow lock that you see in your browser, it's enabled what we today call e-commerce. There's a lot of enablement that comes from security. And I think we are lacking, and this is everything from nomenclature to ability to communicate things with facts and numbers, communicate the value back to the business leaders.
Yeah, you can see that. So, guys, thanks for coming on the show. Not only how can people follow you, but how can they learn from your experience from the Cleveland Clinic?
Well, I think the best way is just, whether it's on Twitter or LinkedIn, is follow the Cleveland Clinic, because I do that. That's how I learn. Hey, I didn't realize we did that. Or we do that, so we can apply some technology to that and make it even better. So the Cleveland Clinic has all sorts of, probably like 3 or 4 different channels within each of those, LinkedIn and Twitter, that I follow all of them, and that's where you find the best stuff. And sometimes they'll include cyber. Vugar was recently featured on cyber, and every once in a while, some of the things that come out of my digital health team. So that's probably the best place. Because the clinic is an amazing organization with, I think you mentioned earlier, very brilliant people, much smarter than I. We just feel honored to be a small piece of it. And so anything decent that we do that people might be interested may be picked up by the larger organization. So that's definitely the best place. We're both on LinkedIn and post some things here and there, but I would say the Cleveland Clinic.
Yeah, and I've been reading your articles. They make their way onto Health System CIO as well, which is a great place to, I mean, you shared almost your entire cancer journey in articles. I can't believe you have time to write. I don't know when you're doing all this.
Well, the coolest thing, though, if I can say this, is that 12 men who responded to me based on those articles went and got their testing done, their PSA tests, and had cancer and were treated. So that's the best part of the journey. And I actually visited with one. I won't mention any names, of course, but we drove out because they were only a couple hours away from where we live. And we drove out with them right before they had surgery, and then after, continue that communication, and they're cancer-free today. So that was the best part about sharing the journey. It takes a little bit of time, but man, we got to share all of us. We go through pain in life, and we go through pain as CIOs, and all good things too. But sometimes it's the pain and the journey that's most beneficial for other people to learn from, and you can help them and help save lives.
Well, I appreciate you guys doing the show. I appreciate you coming on and being able to focus on cybersecurity. And at a future date, I would love to go through that entire journey and just help to get the word out to our audience. And I really appreciate what you guys are doing and innovating in this area. It's fantastic. So, all right. So please come back every Friday for more great interviews with influencers. And don't forget, every Tuesday, we take a look at the news that's impacting health IT. This show is a production of This Week in Health IT. For more great content, check out the website, thisweekhealth.com. That's all for now. Thanks for listening.